Okay, for all of you who want to know why we shouldn't be playing football anymore, we just talked about that.
Oh boy,
It's true.
uh-huh.
I'm not
Yeah,
advocating
yeah,
for the NFL to go away.
Right.
Trust me, I'm not. Concussions, why the symptoms are not going away. And it's a serious thing. I'm Dr. Martin Rutherford. I am a chiropractor. I'm a certified functional medicine practitioner. And
Dr. Randall Gates, board certified chiropractic neurologist, as well as being a chiropractor.
And because of him, and because I've had 9 of these, I'm kind of excited about this presentation. In fact, I've been reading up a lot on the brain lately, relative to just brain function, and I've gotten a lot better understanding of my brain and why I can't do certain things, like why I'm a cheap date. Like if I have like one drink, I'm like stupid, so I don't do that anymore. The concussions could have something to do with that. Concussions can be amazingly life-changing, and I think they're still just evolving. The understanding of them are evolving. I've had a lot of patients come in with whiplash injuries over the years, and they'll have their bell rung, and they won't know where they're at. Sometimes they'll forget their memory. You know, maybe for a month afterwards, they'll walk into a room, not know why they're there, or they'll forget their keys, or maybe they just won't be able to say their words or something along those lines. And then it kind of drifts away. And then those symptoms kind of drift away, and they go, oh, I got through it. Oh, I got better from it. Oh, I'm okay. The truth is, a lot of the people who should be watching this concussion presentation aren't watching it, because a lot of the symptoms that they have today are coming from concussions that they had a long time ago, and they're not even aware of it. And we're going to talk about some of those when we talk about pre-existing risk factors that are not just pre-existing risk factors, but also can be caused later on by the concussions. I know I had my whole life changed a couple of times because of concussions. Lost skills that I had, was very good in math. Suddenly, to this day, I have a very difficult time adding and subtracting, although it's gotten better in this past year. I'm no math genius anymore. That's putting it mildly. And that kind of changed the trajectory of my career, which hasn't been bad. But for some people, it's devastating. And because the symptoms have gone away, they don't connect that they can't do this anymore with that, and so on and so forth. So this is like a big subject. It is now getting the attention that it really should get. I hate to say that, because really the reality is nobody probably should be playing football. I mean, but it's a national sport. It's this. I'm not anti-football. I don't know what they're going to do about it, because as they study what we're studying, it's just going to, the evidence is just going to keep saying, look, I haven't signed a contract that I know I'm going to have brain damage before I get this, but I'm willing to take the chance, or the trade-off's going to be okay for me, or whatever, because there's nothing they're not going to put them in big cellophane helmets or anything like that that's going to stop this from happening. Because the fact of the matter is, in my opinion, and I haven't discussed this with Dr. Gates, but I do all the intakes. A lot of people have concussions that they don't even know that they ever had. They hit their head on a beam,
right.
And they got their bell rung for a little while, and then it went away a couple of days later, and they thought, oh, I'm fine. You're not fine. Okay, it is affecting things. Why do we talk about it? Concussions. Dr. Gates is a board certified functional neurologist, chiropractic functional neurologist, and he kind of cut his teeth on dizziness and vertigo and balance and migraines and ultimately concussions. Okay, so there's a big area of interest for him. But we also treat chronic pain. And what we have come to the conclusion of, and have said it many times, but it's just consolidated a lot more in previous weeks for us, is, man, if you got any kind of chronic pain, you are not getting it gone for any length of time without addressing any problems in the brain. And concussion is a problem in the brain. So let's talk about concussion. Let's talk about concussion versus post-concussion, unless you want to add on to anything I just said.
I'll just clarify one thing. You know, we talk about functional neurology. I think sometimes people may not know what that is. Functional neurology, as a chiropractic neurologist, we have to look at diagnosis. So I have to be able to diagnose you with a mild traumatic brain injury or concussion. The medical neurological perspective is to say, can I give you a medication, or do I need to refer you for a surgery in that situation? My position as a chiropractic neurologist, I have to determine, do you need an MRI scan, just like a medical neurologist? But we'll be different in our treatment application such that we may try and say, okay, are there parts of your brain that are not working right from the concussion? And can we get them functioning better again?
Okay, so they're looking for pathology.
And I'm looking
You're
for pathology
looking for
too.
pathology, but you're also looking for abnormal function, which they're
right.
not even looking for. Not a criticism, but they're not looking for it because it doesn't show up on the MRI and it doesn't show up on the CAT scan. It only shows up if you do a really thorough neurological exam.
And interestingly, in the medical neurological community,
not banging on a neurologist.
No, not at all. Because we have friends who are neurologists, and we refer to neurologists all the time. But just so you as a patient can understand, there may be subtleties of your examination that can be considered "quote unquote" normal. You know, you don't have a horrible neurological finding, but maybe it's just mild. And for a concussion patient, that may be significant. Whereas, you know, for a stroke patient, maybe that's not significant, if you know what I mean. And the whole background to this discussion comes from the fact that within the medical neurological community, concussion had a lot of stigma up until recently. And I can say that from the textbooks that we're all trained to read in, where they would go on and on about people who had concussions and they continued to have symptoms. And there was a lot of debate, you know, is this person just malingering, or are they making up these symptoms so that they could gain money, you know, from suing somebody? It's called medical legal gain. And so there was a lot of debate from some really great neurologists about this. And it really, in my opinion, I saw the tide turn around 2009 when a really big article came out in the New Yorker, and it was based on scientific data from a neuropathologist who was looking at the brains of former boxers, former NFL athletes. I think there may have been a hockey player in there too. And she was seeing that their brains looked like the brains of someone who has Alzheimer's, or very, very similar. And that sparked this whole new debate of this entity called chronic traumatic encephalopathy. You probably have heard of CTE. It's been discussed in some of the news sources. Just know that there's this newly defined neurological condition for people who have suffered repeated head injuries, and we can see that their brains are different than someone who has not suffered those brain injuries.
Yeah, you'll see it when they evaluate these football players' brains. I've heard it a couple of dimes lately, that somebody died or somebody commits suicide, they looked at the brain and they had CTE. So if you haven't heard of it, that's where you would hear of it if you look at it there. So concussion.
So yeah, so within that framework, now you kind of understand the background information. The neurological community, in my opinion, I saw them do an about face, especially, it seemed to be prompted by the NFL, because the NFL had to say, okay, some of these guys, their brains look like an Alzheimer's patient. Is it the head injury that's doing it? We need more research. We need to find out about this. I was at a medical neurological conference a few years back, and they were really investigating this issue. And since then, more and more data information is coming out about this. And now more validity is being given to patients who have had concussions, and they continue to have symptoms, even though their concussion was a week ago, 3 years ago, 5 years ago. They're still having similar symptoms, and that's called post-concussion syndrome. And probably if any of you are watching today, you know someone with it or you have it. And we're going to go into what only the concussion does, what the subconcussive hits do, and really what's going on in your brain causing you still to have symptoms months to years afterwards.
Yeah, and you do. And you do. And sometimes you'll lose function, sometimes you'll lose function permanently, sometimes. And there are things that can happen that can get some of that function, I won't say all of it, but that can get a lot of that function back. And we're going to discuss some of those things too, because I've had that experience. I've had the experience of having quite a bit of function come back. Not my math skills and not my ability to remember names very well, but I've had a lot of function come back. In fact, if you'd heard me talking 5 years ago, you would be surprised that I'm able to speak like this. And I know a lot of you out there would say, stop speaking, period. But I am speaking, and I'm speaking pretty clearly, and my thoughts are pretty clean. And that wasn't something that was happening as little as several years ago. So subconcussive hits. How do you want to go with this? You want to do you feel like you want to describe concussion first? Just like concussion.
Sure.
Wham, I got my head, brain, hit, and that's neurons are now dead.
Right.
Is that enough?
Well, you know, it's funny because at the American Academy of Neurology conference that I went to, and I heard one of the world's foremost researchers on concussion speak, and one of the best diagnostic tests they had for concussion was if you look glassy-eyed after you're hit in the head. And I was just thinking, really? This is the best we could come up with. There were other signs and symptoms associated with concussion, but looking glassy-eyed was one of them. That just tells you that we're in the infancy of this problem. And so if you have a concussion, you may lose consciousness, you may not lose consciousness, you may just feel disoriented. The classic example is the football player who runs into the opposite team's huddle because they don't know where they are. So spatial orientation tends to be one of the key things that is disturbed with concussion. Decision-making, mental fluidity, so the ability to go from one cognitive set to another cognitive set, meaning your ability to shift your attention and process different things, that can be slowed or hampered by concussion. You may have headaches after a concussion. And so that's kind of how concussion is defined. But within any head injury, you need to be properly examined. You need to have a neurological exam by somebody who is skilled, because when somebody has a head injury, they may have more than just a concussion. They may have a skull fracture. They may have a minor bleed that may develop over 3 days to a month in their brain that has to be accurately diagnosed.
Yeah, you may not feel it at first, and then all of a sudden, a couple of days later, it starts coming on. You go, oh, it wasn't a concussion that happened 10 days ago. Meanwhile, that bleed is just starting to have effect.
Exactly. So all those things have to be properly ascertained. So for any parent out there who has a young one who's playing sports, or you're a college athlete and you think that you had your bell rung and you have a concussion, you got to go through a concussion protocol. You got to get examined to make sure something more serious is not going on.
And I would take it one step further than that. I would even say, look, if your kid's going along or you're going along and everything's fine, and all of a sudden you hit your head, you start getting any change in these cognitive functions, I'm just not feeling as well. I don't have as much energy. All of a sudden, for no reason at all of a sudden, or you start having gut problems or something like that you've never had before. This is something that when Dr. Gates described functional neurology, and I'm in functional medicine, this is something that the functional world is very aware of, because again, I think one of the things that is going to hamper research to a degree is going to be they're going to be looking at the MRIs. They're going to be looking at testing,
right.
And that testing may not show anything from your initial concussion for months or years. Whereas the type of exam that Dr. Gates is talking about will show an abnormal function immediately. Now, he won't know for sure whether that abnormal function was there before you got the concussion or not. We're going to talk about that. However, he's going to take a thorough history, as would I, and you would kind of go, well, this doesn't sound like it was there before, or you didn't have a gut problem before. And you can look at our gut-brain connection videos to understand why I'm saying that. So I would say I would take it back to, and I know they're not doing this, but I would take it back to, listen, if I'm here and I whacked my head and I'm fine and my stomach's fine, my bowels are fine, and my energy levels are fine, I'm not talking about the symptoms that you would definitely connect with it. Okay, I've experienced this is what I'm saying. Okay, and then all of a sudden you get this whack in your head and things change, and you can't sleep well, and your gut's bad, and your energy levels go down. You have to know that the brain controls everything, and you have to, and that should be a trigger for you to go, I need to go see somebody, preferably. And I'm not trying to do promotion here now. Okay, I'm not, but preferably you would go check pathology. I would think first. Absolutely. You would go make sure, get a CAT scan, get an MRI, get all that stuff, make sure it's there. If it's there, it's there. You got to deal with it. But if it's not, you don't want to be going, okay, I'm okay. Then if you have that symptom change, I would be looking for a functional neurologist. And if at the very least, if you can't find one of them, call a functional medicine doctor and say, hey, do you know anything about the brain? Because there are functional medicine doctors who have taken extensive courses in the brain, and there are functional medicine doctors who haven't. So if you're watching and you're thinking any of those things, that's kind of the way that I would go about it. Pathology, functional neurologist, functional medicine. Guy's got to know what he's doing with the brain in the functional medicine world, at least chemically. And that would be kind of the flow I would go with.
Yeah, absolutely.
Okay.
Sure.
Concussion.
So that's kind of concussion. And then we've been doing broadcasts on concussions now for 2 years. I think our first one was 2 years ago. And in that time frame, I mean, the data is evolving rapidly. So we used to know about concussion, let's really get into post-concussion syndrome now. So now we're talking about the person who has a concussion and they're still having symptoms months to years afterwards. Whereas a lot of people get concussions and they may not have any symptoms after the initial head injury like a week later, and then they're perfectly fine. And that does happen with isolated incidents of concussion. But for the post-concussion syndrome patient, and I'm also going to glob into this group people who have had subconcussive hits, meaning you didn't have concussions, but you hit your head a lot. So really any collegiate, you could even argue high school football player,
like
professional football player
heading the football,
soccer players heading the football, NHL or any level of hockey players, these people who keep hitting their head repetitively, we're now seeing that the same problems with the post-concussion syndrome patient are there with these individuals who don't have post-concussion syndrome, but have played these sports. To a similar or minor.
You have to know we're both athletes. Degree. We're choking on this, right. Okay.
Well, I think back,
ex-athletes.
I mean, maybe it was other factors, but the first time I had a neurological exam, I couldn't stand with my feet together and my eyes closed.
Ex-offensive lineman.
I played football for 8 years and I was just blown away.
I played soccer and baseball and I wrestled and ultimately skied.
So yes, these hits can have long-term effects. So let's get into that. So we used to think that it was just these energy-producing cells in the brain called the mitochondria. They're not actually cells. They're within our cells, and they make the energy within our brain cells. So one of the preliminary thoughts was that these mitochondria could not make energy properly after you hit your head or if you keep hitting your head. And that has been shown to be true in part. But now we're seeing that other more blatant things are going on in the brains of somebody who's hit their head a lot. One of the key things now being shown is disruption of what's termed the blood-brain barrier. So the blood vessels that go into your brain should be like pipes, and they should only allow certain small molecules to get into your brain because we want to have protection from your body into your brain. Your brain is a very sensitive, delicate organ. You don't want a lot of inflammation from your body, for example, going into your brain. You don't want most of your immune system from your body going into your brain. And one of the key things they're seeing with post-concussion syndrome patients as well as these subconcussive hits is that this blood-brain barrier is damaged. So the pipe becomes leaky, and that can cause inflammation from your body to go into your brain. It can cause immune cells from your body to go into your brain, and then to report back to the rest of the immune system to basically start attacking parts of your brain. And we have articles attached to today basically demonstrating it. And that's why the information is kind of scary. And that's why we're kind of both taken back, because the more we learn, the more we realize, would you really want Johnny to be playing?
Yeah, we are definitely not anti-sports.
We're not anti-sports, but these things have to be considered, and informed consent probably has to change with these sports. And
we talk about guts a lot. To dovetail on what you just got done talking about. And some of the research shows that with this blood-brain barrier, if you have the infamous leaky gut that we talk about, or if you have a celiac, which will cause a leaky gut, or even if you have certain types of gluten sensitivities, they'll get through your gut, they'll get through the blood-brain barrier, and then they'll screw up your brain and perpetuate concussive symptoms. So
right, we did a whole broadcast on leaky brain. You should go back and watch this because the head injury by itself is being shown to produce blood-brain barrier damage, but then it's not repairing itself. So you have to ask the question why, and that's why I want you to go back and watch that broadcast on leaky brain. It's a horrible term, but that's just how it's being acknowledged, because other factors in your physiology may be promoting the blood-brain barrier to stay leaky and you to keep having symptoms. And one of the current concepts is with the blood-brain barrier being abnormal, the immune system gets into the brain, it's causing inflammation in the brain. Parts of your immune system that just shouldn't be there are there. And then if you have immune activation from another area of your body, like the gut where 70% of your immune system is, it's almost like you're getting a repetitive concussion all the time.
Yeah.
You may be eating gluten and having the symptoms of a concussion. I have a patient who's probably watching today who took a supplement because we were trying to decrease inflammation. His immune system appeared to get aggravated to it, and he had all the symptoms of a concussion again, yet he didn't hit his head. Right. This is what you got to get if you have post-concussion syndrome, because this is going to be the difference between you getting better or not better. In our experience, because we treat a lot of these patients, and this is what the data is all starting to show, and the data is getting so strong again, it's almost
Scary.
spooky.
Yeah, it's scary. It's scary because it has the potential to really change our culture in a lot of different ways. And I'm not saying that I'm excited about that by any stretch of imagination, but there's 125 million. Well, it's probably 125 million by now, but there was at last count like 118 or 119,
17,
117 million chronic pain patients in this country, and this is part of it. And just to jump on what Dr. Gates is saying, if all these things that will make you have a concussion perpetuate over the years will also make you more susceptible to have concussive symptoms.
Right.
So if you have these things beforehand, I had a bad gut my whole life. You know, in retrospect, who knows? I grew up in my mother was Italian. You know, I'm eating pizza, I'm eating bread, I'm eating pasta like 6 nights a week. One night
until a few years ago, we found out he had celiac disease.
Yeah, until a few years we found. So I may have had a bunch of this stuff beforehand, and then I had several concussions, mostly sports-based. And in retrospect, we were able to see things really changed at those points in time. And I was a lightweight drinker, literally my whole life. So, I mean, that didn't work out very well. And all these things that were there beforehand made me more susceptible to having the symptoms afterwards, and would make you more susceptible to having the symptoms afterwards. So again, in the functional, the reason that we married our two disciplines is it just keeps coming down again, over and over again. None of these chronic pain issues, even concussion, is not particularly just an isolated issue of I got a bang on my head and I got a bunch of neurons that aren't working anymore. Because when you get a concussion, there are brain cells that get damaged and they're never coming back. But you're having brain cells die every day. You know, so it's not particularly that. I mean, it's like if some of them disappear and don't come back, and all of a sudden you can't do math when you were in a high-end math program, and then all of a sudden you can't add. Well, you know, those neurons are gone. Okay. However, that's not the average case. The average case is things are going to happen. You're going to see a change, and then later on, you're going to start seeing other symptoms that you're not going to connect to that concussion. And the chances are, if you've ever had a concussion, you need to think about every symptom you've had right now, and think about which ones did I not have before that concussion. And there's a good chance that there is a contribution there from that head injury. And we're not being like crazy about this. Again, Dr. Gates tells you this is what we do. People don't come in here with concussions. Occasionally they do, but they come in here with concussions because they had fibromyalgia and a concussion, or they had restless leg syndrome and a concussion, or they had dizziness, vertigo, imbalance, and migraine and a concussion. They just forget to tell us about the concussion until Dr. Gates starts taking their history, or until they fill out our 17-page history. And it turns out that that part of the brain is contributing to what's going on with their chronic pain issues most of the time. I would almost say almost every time. So it's something you really, 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 really need to understand. So where do you want to go with that? You want to go into dementia, or you want to go more with?
Yeah, I think dementia is a good spot to hit. So basically, we talked about the chronic traumatic encephalopathy. What they're seeing is what we term hyperphosphorylation of tau. Basically, forget I said it, but I needed to say that. There's a certain protein that gets hyperphosphorylated. You don't need to know what that means, but that happens in dementia amidst other things going on. But what we see in people who have repetitive head injuries is that the hyperphosphorylation of tau does happen. And I attached a research article today that basically demonstrated this happens independent of the immune activation in the brain that we've been talking about. So that's another piece of the puzzle that kind of needs to be elucidated a little further with time and more literature. And as we start to see that information, we'll probably do
that's part of what creates the whiteness.
So the plaques are a little different. The plaques are a little different.
That's why he's the functional neurologist.
Yeah. And so the hyperphosphorylation of tau, just basically think that the brain is not able to send signals within the brain cell. The brain cells don't send their signals as well as they used to, because the architecture is a little bit off.
Right, I remember
and then that
now.
can be part of the process that leads to tangles. But the tangles are different too.
Okay. See,
but head injury is a predisposing factor to Alzheimer's. So, you know, everybody with Alzheimer's gets caught up in the genetic component, and genetics can be a feature, especially of early onset Alzheimer's. But there are all these other factors that really seem to set into play the mechanisms for things like dementia, one of them being head injury. Other things being insulin resistance that we're going to talk about today, homocysteine levels that we talked about a couple weeks ago that we'll kind of hit today as well. One of the research articles we attached looked at college football players, and they showed that their area for memory in the brain was shrunk as compared to healthy controls. I mean, this is just huge, huge data for them going forward. I mean, if that is your son, you may want to, I mean, how would you look at that? And then we also attached an article where they're talking about antibodies to the brain being seen immediately after a college football game in subconcussive hits. So these are guys that didn't get a concussion during the game, but they just took a lot of hits to the head. And after the game, their immune system was starting to kill their brain. So the risk for dementia is higher with chronic repetitive hits, chronic concussions or repetitive concussions. If you've had these things, you've got to, number one, get your blood-brain barrier checked. There are tests now that can do this. The research study tests are expensive. The most clinically feasible test is called a Cyrix Array 20 that can definitively show if you have a blood-brain barrier compromise. That's number one.
How much is that?
Oh gosh, it's probably in the order of $250.
Yeah.
I think somewhere around there, $250.
It's worth it.
Yeah.
Trust me. I mean, I'm not saying if you have financial issues, I understand $250 can be a lot, but this test is amazing. And they probably should charge a lot more for it, but they don't. And it would be worth doing. A blood test.
And then you got to argue, why is the blood-brain barrier repeatedly leaky? Then you need to do a Cyrix Array 2, which we do on every patient. We wrote an article as to why this test should be done on every pain sufferer, because it goes back to the gut. Because when there's disruption in the gut, if there are pieces of bacteria getting into your bloodstream from the gut at too high of a rate, that's being shown to cause leaky brain syndrome or breakdown of the blood-brain barrier, which is heavily significant to this discussion.
And perpetuate your concussion syndrome.
And then you need to be tested for insulin resistance, prediabetes, metabolic syndrome, syndrome X. Just know if you're a guy and your waist girth is bigger than your hip girth, you probably have it. So this needs to be evaluated, because once you have insulin resistance, it sets into process these biochemical pathways in the brain that cause degeneration in the memory portion of the brain.
Yeah, your brain needs blood sugar to work. In fact, isn't that the only real nutrient to the brain? Like glucose,
one of the key ones.
Like one of the key ones. But it doesn't need too much. Doesn't need too little. Insulin resistance produces too much. It's highly inflammatory. Next thing you know, you got a bad chemical environment going on in an already susceptible, damaged situation. So
exactly,
blood sugar.
Blood sugar has to be acutely assessed,
pristine.
And not just told, oh, you're kind of okay, or oh, you're not diabetic. If you're anywhere on the pre-diabetic spectrum, you'll have to grill your doctor on this. Say, I'm really concerned about having insulin resistance. Test me for this. Because sometimes insurance companies don't want to pay for these tests because it's considered unnecessary if you don't have diabetes. So you've been warned. And then you need to have your homocysteine levels checked, because homocysteine is an inflammatory byproduct that's now being associated with Alzheimer's, with vascular dementia. It's really important to have your B12, your B9 levels, your active form of B9 checked, so we can see what the inflammation is like within your brain as well.
And if you get your homocysteine level checked and they tell you it's normal.
Oh, that's true. Good point.
Then you need to
make sure it's under 10. 10. So the average value for homocysteine on any lab is about 15. Anything over 15 is considered abnormal. Just know, for the purpose of this discussion, anything over 10 is abnormal. And you can cite our broadcast 2 weeks ago and all the research articles we have associated.
So you need to look at that lab yourself. And if it's 12 and they say, oh, you're doing great, you're not. Your neurons, your concussive damage is being attacked by an inflammatory process, and you need to get rid of that. You need to find out what the process is, but that's homocysteine. Those are the numbers on homocysteine.
Exactly. And then you need to have a neurological examination. You have to get examined. Again, the neurological examination is typically done to rule out things like tumors, strokes, major neurological conditions. That's how the classic medical neurologist is trained. Within the setting of concussion, post-concussion syndrome, repetitive subconcussive hits, things have to be looked at with a more fine-tooth comb for example. So if you put your feet together and your eyes are closed and you don't fall over, but you almost fall over, that can be rather significant because that can indicate areas of your brain involving the balance system and spatial localization are not working correctly. And what we have found from a functional neurological perspective is that frequently one side of the brain may not be activating at the same rate as another side of the brain. Simplistically, we can get more complicated about it. If you want more complexities, call us. But generally that's what can happen. And what we have seen is that you can actually recruit and activate those parts of the brain that may not be working well and get them working better. Or you may have to work with other areas of the brain that talk to the damaged area to get them working better. It's a whole complex field unto itself, but that's just a generality that you need to know about from a functional neurological perspective, because actually functional neurologists, chiropractic neurologists are getting some notoriety at this point for their help with concussed patients, post-concussion syndrome patients. And it's pretty neat. But we look at it all in the context of everything. So you can give somebody brain exercise and maybe improve their balance for 8 hours, but if they have leaky gut syndrome and a gluten intolerance and other food intolerances, and that's creating inflammation throughout their body, and they have insulin resistance and their homocysteines at 22, you can do these brain exercises in our experience so the cows come home. But until you rectify those factors, the blood-brain barrier isn't getting healed, the insulin resistance not getting fixed, and the inflammation is not going down in the brain to allow someone to have permanent long-term improvements in their brain function.
Yeah, ironically, there's almost a little battle going on between the functional medicine world and the functional neurology world, and it's a dumb thing, and the patient is going to be the one to pay for it because you're going to see a presentation by a functional neurologist that says, just do this. But let's step back to the practicality of it for a second. When I got the main bulk of the hits on my head, they didn't have MRIs, they didn't have CAT scans. Basically, they took me to the hospital at one time after I urinated in a waste paper basket instead of the urinal, to go back to your other
abnormal spatial localization.
Yeah. And it was after that, after I had been hit in the head, after I was practically blind. I'm watching the rest of the soccer game. I don't know what day it is. I don't know what my girlfriend's name is. I don't know anything. I go up there, I'm yelling at the refs after he just got done telling me I played one of the greatest games I've ever played. And he was just, and nobody got that I had a concussion until I started urinating in the waste paper basket back then. And then they took you to the hospital. But basically, they just watched you. Mm-hmm. Pretty much, they just watched you, and they watched you all night long. And they kept waking you up and stuff like that. And that's what they did. So back then, you didn't have much of a prayer. Okay. Now, though, you'll go to the hospital. And they'll do an MRI and they'll do a CAT scan. And I'm going to
usually do a CT scan if it's immediate.
Okay, and I'm going to do a little Q&A here, okay, because then they'll do that, and I'm going to guess that they don't do a full neurological exam at that point in time.
Most ER doctors are trained to do a mini neurological exam just to make sure that you're not like.
And I'm not cutting them. I'm just telling you who've been through this, okay? So you're going to get a mini exam, but then they're looking, again, remember, they're looking for pathology. They're looking for a subdural hematoma, they're looking for a brain bleed, they're looking for whatever they can look for that may have been damaged from this big hit. Then if they don't see that, then it's pretty much, okay, go ahead and
go home and keep waking them up just to make sure that they're okay.
And then if you come back, then they're going to send you to the neurologist. Is the neurologist, and I'm not banging on
it. And we have neurologists who watch these
broadcasts. Is the neurologist going to do a full exam? And if the neurologist does a full exam and the answer is yes, then what is the neurologist going to do? The neurologist is going to do.
They may refer, so, and this is not to the neurologists who watch this broadcast.
Right.
But generally.
I'm just talking to what people are generally going to experience so they know what to do.
Generally, what people are going to experience is that the symptoms are going to be treated with medications. That's basically how post-concussion syndrome is managed. If you have depression, that's going to be managed with antidepressant. If you're having anxiety, an anxiolytic. If you're having migraines, it's going to be managed with migraine medication. That's kind of what it boils down to. There are specialty concussion centers. We've had patients go to them, and frequently they just use fancier medications for the problems, in our experience.
Now, if you're highly advanced here, the next step would be to look up one of these guys. Okay, I'm not promoting because
and we've referred patients who watch the broadcast to guys in New England and Canada.
Now, if you go to a functional neurologist though, and let's say they're refractory to the thought that maybe a gut might be perpetuating your concussion problems. It's not a bad place to be, but it's not the best place you can be, okay? You probably, and there are a lot of functional neurologists out there, and pseudo functional neurologists out there who actually get what we're talking about with the blood sugar and the gut brain. But this is what you're looking for. You're looking for something like this. And it's going to go that way. We just went to a 3-day seminar 2 weeks ago. And it was the first time we've ever heard two disciplines talking about putting it together the way that we're talking about, the way that we do it, the way that we've been doing it.
Even though we don't agree the circumstances under which they're doing it, we've been doing this for 6 years.
Right. They're going to make it a lot more complex, and the treatment's going to be a lot more involved than it needs to be, and it's going to be a lot more expensive. I'm sorry, and my mentor, Dr. Krasian, I apologize, but we'd be happy to talk with you guys, but because I think we got this wired down a little bit more, you know, in that fashion. But this is the guy who taught me everything I know, whether he knows it or not. And it's just a funny thing.
And my mentor is on the other side of it, Dr. Carrick, who basically figured this out. And not enough credit is being given to him at this point.
No, he's the guy who figured this out.
And one of his arguments is, you know, a lot of these problems with the gut may be stemming because of the head injury. So if you fix the head injury, you can fix the gut, which we've seen to be true.
Yeah, but we would say it's more of a closed circuit.
Right, we feel have to be addressed together. We're big on giving credit where credit is due. Dr. Carrick, and my experience,
you can look these guys up.
He figured this out. He was at the front line of figuring out traumatic brain injury, mild traumatic brain injury, in terms of rehabilitation, frontline therapies that are going to help a lot of people. And he's trained a lot of doctors, including myself, and we're employing these strategies very effectively and successfully.
Yeah. So if you've got a concussive injury and you're watching this, we're just telling you the flow. This was the paradigm flow that we had to come to be able to get these things under control and keep them under control and give people that. Look, I mean, I was heading for something. I don't know what. When Dr. Gates came in here, he was an unknown entity. And he kind of wanted to work here. And one of the things that, you know, I didn't know him. I didn't know how valuable he was going to be to this institution. And so I had to do an exam on me. And I was watching his face as he was going like, do I tell this guy how messed up his brain is? I'm like, wow, this guy really knows what he's doing. So that's kind of how we got together. I just paraphrased it a little bit. There was like a zillion things more than that, but it was part of when I finally went like, okay, this guy's really like gets it. But I wasn't doing very well at that point in time. I was under a lot of stress. I was trying to put these things together. I was trying to come up with a way to put this together in an organized fashion. And I was working 6 and 7 days a week, and there were people who were worried about me because I was working too hard and all that kind of stuff. Man, let me tell you, I am like light years better.
You are so different. You are coming up with vocabulary words that I'm just shocked by and amazed by all the time.
Yeah, I used to teach English in one of my 6 past lifetimes.
Because frequently when Dr. Rutherford used to give speeches, and this is no condescension, but you know, he would look like this, and he would be struggling for the right word, and he couldn't find the right word. And now when we sit and talk, I mean, he does have an expert level vocabulary, and it's neat to see. And it's because of everything we're talking about here.
So I don't think I'm going to get Alzheimer's.
I don't think you're going to get Alzheimer's
because I'm going this way now.
But this is one of the major considerations for people who get these head injuries and these football athletes.
You're susceptible at that point.
Yeah, we can't say you're necessarily going to get, but your probabilities are much higher.
Your probabilities are much higher. So that's what we're trying to say. I mean, this is like obviously this is something that is near and dear to me, because the more I learn about the brain, the more it's explaining a lot of the weirdness that I have experienced and dished out in this life. And it's kind of fun to like know it, but you know, now I'm not afraid that I'm going to be some blithering idiot when I'm like, you know, 90 years old and I'm going to be a drain on society and all that type of stuff. Who knows? Maybe I still will be. But
if you had not have done this, you would have been a blithering idiot by the age of 70
or sooner.
Right.
Well, I'm 60.
You were, but I mean, literally, you were.
I know.
So that just speaks to the power of this. I mean, we have had.
So that's what we're trying to say.
High-level professionals come through here. We have had. Oh my gosh, we had this one.
We've learned from the best.
Yeah, we have learned
the best of the best of the best.
We've had some very high-level people who have concussions, and that's high function. That's what I'm saying. It doesn't matter if you're a school teacher or if you're a doctor or if you're heading some multi-million-dollar corporation. If you can't think, it's equally as concerning. And if you can get somebody thinking clearly again and remembering and able to find their way home, these are big, big deals. And it's a lot of fun. And it's very fun. It's fun for all involved.
Yeah, it's a good thing.
It's really gratifying.
So that's our from the gut concussion. We covered everything we can possibly cover. We crossed a few barriers there that might be uncomfortable relative to the paradigm of I go to the hospital, I go to the neurologist, maybe I go to the functional medicine doctor. We're not trying to grind any functional medicine doctors or functional neurology doctors. We're just saying we're on everybody's side. But guys, we've been through this. We've been through this as patients. We've been through this as clinicians. We have developed, some pretty effective ways of going about things, and things that are relative to the things you're going through out there are massively cost effective. But so if anybody out there wants to, make comments on it or anything, we're certainly willing to discuss it with you. But our position is not going to change from what we just got done saying, because we're pretty certain about what we're saying. So anything that we can't take a lot of questions like we used to, and we can't do a lot of personal. Doug Gates used to do email a couple of hours a week answering everybody's questions. Okay, we have busy practice. We look at people's histories. If you come in here, man, I just realized the other day that our vetting process is like about 5 hours long. By the time we do a consult, by the time we do our exam, and by the time we do a little treatment, and by the time we then go over that with the patients, and not everybody becomes a patient, not everybody is qualified to be a patient, and that's what you're asking us to do when you write something and say, I have this, and can I get this supplement, and what should I dose it, and that type. I mean, we can't tell you that, and it's unfortunate we can't tell you that, but we can't tell you that. We do have a way for you to get a consultation. We do charge for it now because it does take that long. It probably takes us an hour to an hour and a half. It takes me an hour to go through the stuff for sure. Maybe longer. I know you take an hour to go through. An hour
to go through all the records. We request all of your records from every doctor you've seen.
And then
we have you type up a history, have you fill out our history, so that then we can look through and say, okay, does it look like it's going to be valuable for this person to make a trip out here one time to get seen? And will we be able to help them through Skype consultations?
So we can do that. We can do that for people who are really interested, and you'll get to talk to me for about an hour. I'm sure you'll be looking forward to that. And but usually by that time I'll be able to tell you whether this is a good thing for you or not. And if I know one thing, I know concussions relative to just my experience with them is significant. And so I'd look forward to talking to you under those circumstances. So anything else you need to know, man, we have so much data online. If you just go to powerhealthtalk.com, you go down to Hangouts, you scroll down to whatever subject looks like interesting to you. Dr. Gates referenced a few of them. Help yourself, and any comments that you have, we will read those, because we want this to be interesting to the people who are viewing this, and we want it to be valuable. We want the guys out there who are questioning our where we get our data from to know where we get it from. All you got to do is look at the end of the Hangouts. It's there. The references are there, and so that's our passionate presentation and plea for concussion. And I'll get passionate about very many things. So at least I don't think so. Yeah. But that's it. And we'll see you next week. Thanks for listening.
Yeah. Thanks for watching.